I wish that everyone knew and began to accept on a broader basis that advanced care planning is not about a document. It's not about something that you have to do and when you enter a healthcare facility. It's more about an open conversation that explores really three things between a patient and their healthcare provider, physician, etc. It explores what matters to you now, who speaks for you in the event that you can't speak for yourself, and what brings you strength. So what do you value? What are the things that will help us know you better to help guide the best medical care for you during a time of a life-limiting or serious illness? Really, advanced care planning is a process. It's a conversation that can begin between patients and their healthcare providers in a setting outside of a hospital about what matters most to the patient, who speaks for the patient, and what brings them to make decisions. So in the truest sense, as we evolve, advanced care planning is about a process of communication between a patient and their loved ones, decision makers, and their healthcare providers. I think one of the misperceptions about having an advanced care plan or an advanced directive or living will or things like that will limit your options or limit your care, which is really further from the truth. It actually opens and broadens the conversation to allow you, a patient or a family, to have the most options per your wishes. Having an advanced care plan, conversation, process of determining what a patient values and what their wishes are on how to live this particular part of their life, and really what technologies that they would accept or not be interested in, so to speak, can only improve the care that patients receive when they are diagnosed with a serious illness or terminal illness. In other words, it helps to match the care based on evidence that might be beneficial for the patient to what their goals and values are. So, in many times that can improve not only the quantity of their life and how long they live, but it can significantly improve the quality of the life that they experience. So basically you're matching the evidence to what the physicians and the healthcare system knows may be beneficial with the preferences of the patient. It also helps the family. So when patients are undergoing serious illness or have a life-limiting diagnosis, it's not just the disease that affects the patient. It affects the family. It affects all those that surround the patient. So having the opportunity to engage in advanced care planning conversations about wishes really helps that entire network and that entire support system know what's in the best interest of the patient. Why should I have a living will, and when does it, quote unquote, go into effect? I think it's important that individuals share primarily with their family and loved ones what their wishes are, what are the things that they value, how do they want to live the last part of their journey, and then to share that with their healthcare providers. So whether it's in the form of an advanced directive or a living will, it really is a statement of what the patient's wishes, desires, and values are, and that can only help to direct their care in the event that they may not be able to speak for themselves. The right time to discuss wishes for medical care really begins now. It begins at the point where you establish a relationship with a primary care physician or maybe a specialty physician such as an oncologist or a cardiologist at the time that you have a diagnosis that may shorten your life or be classified as a serious illness. So the conversation really can't start too early. These are not comfortable conversations for many individuals, not only physicians who feel uncomfortable with the conversations many times, but also family members who don't want to necessarily discuss this with their loved one because of many of their fears. Their fears that maybe their loved one will interpret that they think they're giving up, or that we're giving up, on you. Or it may begin to unmask some of their fears about dying. And so it's really a matter of normalizing some of the conversation. An advanced care planning conversation should become as normal as a preventive conversation about why you should take a flu shot or why you should have a screening mammogram or colonoscopy. It should become part of the conversation between patients and their providers.